So, welcome back to our YouTube channel once again. Today, we will discuss regarding the pathology calcification. So, in the name itself, we can understand, right? Pathologic means, yeah, it is because of some issue, some disease, or some problem. It can be anything. It is not a normal thing, right? Pathology, the term itself, it is like a not a normal thing, right? Not a physiological, not a proper function which usually occurs in our body. So pathologic means obviously it is due to some kind of any disease or injury, or it can be anything. The next term, calcification, means the deposition of calcium, the calcium salts. So let's, before we move to the definition and the types, we'll just I will just briefly explain regarding what are the normal process happens in our body. So there is a process called biomineralization. Biomineralization. Sorry. Biomineralization. Yeah. So there is a process called biomineralization. That means it is a very natural, it is a very normal physiological mineralization, but it will not inhibit, it will not allow, or it will inhibit any unwanted precipitation. Any unwanted which precipitation? Mineral precipitation in our vascular and soft tissues. So biomineralization means our usual normal function of our body. It is a physiological mineralization. It will inhibit any mineral precipitation. So like we can say, the mineral we have taken here, like calcium, it will not allow the calcium to deposit in any soft tissues. Why? Because normally the calcium salts is supposed to be in two places. Which are the places? One is bone, osteoid, and another place is enamel. So the thing which I told, the physiological mineralization, the biomineralization, that is a very normal thing. It's a very normal physiological process. It is a very normal function of our body. That we'll take an example here only. Okay, we'll consider the calcium salts. Already I told you the calcium salts, where we can see the calcium salts in our osteoid. Osteoid means bone. In our bone and enamel. These are the two places that we can see the calcium deposition, calcification, the physiological calcification. We can see the physiological calcification, the deposition of the calcium in our body in only two sides. Which are the two sides? One is bone and another one is enamel. Okay. So, apart from these two sides, which are the two sides? Other than this bone or enamel, if we see the sites, if we see the calcification in any part of our body, in our normal tissue, let it be any part of our body, then it will be a pathological calcification. Okay. So, other than if we are seeing any precipitation of calcium salts or the deposition of the calcium salts, it will be a pathological calcification. Okay. So let's see, even in the pathological calcification you can see, right, the types are there and all. So before that, okay, we'll just see what is the definition of the pathological calcification. What is the definition? It is a deposition. Obviously it is a deposition. It is a precipitation or deposition of calcium salts. From the name itself, calcification only, we will understand the precipitation or the deposition of calcium salts in our tissues. In tissue means it can be any tissue in our body, in any tissue other than bone or enamel, isn't it? Other than bone or enamel. Suppose if the calcification happens in a bone or enamel, it is not a pathological calcification. It is a physiological mineralization. Why? Because it is normal, right? In our bone and enamel, the deposition of calcium is there. And one more thing, not just calcium salts deposition, the deposition of calcium salts along with some amount of iron, some amount of magnesium, and some other mineral salts. Apart from that, Not just it's just because of the external factors. I told you the pathological mineralization or the calcification, it can happen because of many things. Like it can be disease, it can be injury, because of injury, or because of aging, or because of inflammation, or it can be because of genetic disorders, or from any external factors. The pathological calcification happens in our body. Okay, so we'll just complete the definition of calcification. Okay, after that we'll just move on to the do you I will just once again I will just tell the calcification I told, the physiological calcification, the calcium deposition in our bone and all. This is like normal thing. How do we get this calcium for our bone deposition? It's from the blood serum. Okay, the blood serum is like a very we have a good source of calcium in the blood serum. The orthophosphate ions, it will come from the blood, then it will go and deposit in our bone for the bone formation. It is like a bone remodeling pathway. The bone remodeling pathway means the mature bone will be replaced by the new bones. Okay, so apart from that, we can divide the pathological calcification into two types. One is dystrophic calcification and one is metastatic calcification. Both these two types, we can divide based on the origin. Based on the origin means how we can say it is divided in the based on the origin. Why? Because the dystrophic calcification you can see only in the places or in the sites where it is a dead or degenerated tissue. Okay, dystrophic, you can see only in the dead or degenerated tissue you can see the particular calcification. The next one, metastatic calcification, you can see not in dead or degenerated tissue, you can see in normal tissue, the normal tissue in our body. Again, these both calcification, the dystrophic and metastatic, both calcifications, etiology and pathogenesis, both are different. Okay, two types are there, both etiology and pathogenesis are different, but morphology is almost same. Morphology we can study it together, but the etiology and pathogenesis it's not same. So dystrophic calcification, from the name itself you can just understand DD, you can see this calcification in dead tissue. Metastatic calcification, yeah, you can see in the normal tissue. Okay, next we will move on to the dystrophic calcification. In first, we will study regarding the dystrophic calcification. So the origin means the place that you can see the dystrophic calcification. Where you can see the classification. Calcification means you know, right? Obviously, the deposition, the accumulation of calcium, isn't it? The calcium deposits. Where you can see the dystrophic DD. I told you no. Damaged, dead or degenerated tissue. That means already dead tissue. Necrotic tissue. Necrotic tissue means, necrosis means what? Cell death, right? Necrosis, apoptosis means cell death. So necrotic tissue means this death, the tissue already which is dead. Already the tissue is dead. So in this kind of tissue, which kind of tissue is damaged, dead, degenerated tissues? In these kind of tissues, you can see this dystrophic calcification. Again, then comes the next point. The reversibility is irreversible. You can't reverse the process. The damage is done, right? The damage is done. Why? The damage is already done. You can't reverse the process because the deposition is happening in already a dead tissue, right? Isn't it? Necrotic tissue means already it is a dead tissue. That tissue is again, you are getting, that tissue is again receiving some calcium, means you can't reverse that process. I mean, the tissue is not going to get normal, right? Then again, the next point is the metabolism. The metabolism of calcium. The metabolism of calcium, here it is a very normal calcium level. It's like there is no abnormal metabolism of calcium, like there is no hypocalcemia, like less calcium, or hypercalcemia, like more calcium in the blood or something. But the calcium level is quite normal. We can just see this is a like we can name it as like a blood vessel. BV means blood vessel. Okay, so in dystrophic calcification there is a normal calcium, the calcium level is normal. here the normal calcium level, and where this calcium will go, it will deposit in the dead, yeah, dead tissue, isn't it? Dead tissue. This is a blood vessel. From the blood vessel, the calcium metabolism is completely normal. There is no hypocalcemia or there is no hypercalcemia in the blood serum, but the calcium will go and deposit on the dead tissues. So here the definition is there. When the deposition occurs locally in dying tissue, see, dying tissues are underlined. In the dead tissue, dying tissue, due to the absence of derangement in the calcium metabolism with a normal calcium level, that is again one main point. The main point is it should be in a dying tissue or dead tissue, and the metabolism, the calcium level. Here, calcium metabolism is normal. Even the calcium level is also normal. If these two occurs, means it is a dystrophic calcification. It is a dystrophic calcification. So what you have to remember, dystrophic calcification means the deposition of calcium, it is going to occur in a dead tissue. And the metabolism, there is no abnormality in the metabolism. The calcium metabolism is normal, and the calcium deposition happens in the dead tissue. It's not because of any hypercalcemia or any hypocalcemia. And one more thing, it is an irreversible process. You can't reverse that process. Okay. Okay, then we'll just move on to the example. Yeah. So example, we can see the causes of dystrophic calcification. So basically this dystrophic calcification, you can see one in dead tissue. You can see some examples, right? Caseous necrosis, breast, and another one is you can see this calcification in degenerated tissue. So basically which calcification? Dystrophic calcification. It is divided into two. That means the deposition, this dystrophic calcification can be found in a dead tissue. I have quoted some examples, as well as you can see this calcification in degenerated tissues. So you can just see. So first eventually we will move on to the calcification in the dead tissue. Which calcification? Dystrophic calcification in the dead tissue. So we can take some one or two examples. So the important familiar example is caseous necrosis in tuberculosis. I hope you know regarding necrosis means cell death, localized area of tissue, the death of a tissue. And you can see this caseous necrosis, right? Necrosis, 5 types are there: colligated, liquefactive, caseous, fat, fibrinoid types are there. In that types, caseous necrosis is there. What is the appearance? How you can identify whether it is a caseous necrosis? By a cheesy like appearance. Okay. And where you can see this caseous necrosis, it's in a necrosis topic. You can see in a TB patient. You can see in a tuberculosis disease, you can see which necrosis? Caseous necrosis. So after the caseous necrosis happened in a TB patient, some deposition of calcium and phosphate will happen. The calcium will combine with the phosphate ions in that dead tissue, and it will form some calcium crystals. You can see the crystals here, hydroxyapatite crystals. Okay, so here in the tuberculosis, which calcification you can see? Dystrophic calcification after the caseous necrosis. Tuberculosis means obviously it is a caseous necrosis gonna happen. Then again you can see again the calcium deposition will come in our breast, not just in TB, again in dead tissue in our breast. In breast it's not caseous necrosis. In breast, fat necrosis will happen. Fat necrosis is another type of necrosis. Out of 5 type of necrosis, fat necrosis is a type, and you can see in breast. And here also after fat necrosis, what happens? Deposition of calcium sorbs, like calcium accumulation will happen. So the dystrophic calcification is divided into 2. You can see the dystrophic calcification in dead tissue. In dead tissue, which all examples you can quote? You can see this calcification in caseous necrosis in TB patient, and again in fat necrosis in breast. There also accumulation of calcium salts will be there. Then you can see a beautiful picture of TB patients. You can see the TB case. You can see the calcium, see, you can see the calcium deposition. So just given this for diagram to understand very thoroughly, you can see the calcium salts, isn't it, in a tuberculosis patient. So which necrosis will happen in a tuberculosis patient? Calcium necrosis. And it is a dystrophic calcification which occur in a dead tissue, not in a degenerated tissue. Then again there comes the second dystrophic calcification, which is occurring in our degenerated tissue. There also I have quoted one or two examples. Atheroma. There also, atheroma in our aorta, the coronary, the blood vessels. These blood vessels also undergo the calcium deposition, atheroma and all. Then again, second one, the goiter in our thyroid. During the goiter also you can see some deposition of the calcium in the areas of the degenerated part. And again you can just see this photo of a diagram of dystrophic calcification in the Mockenberg's arteriosclerosis. You can just see this calcification. See, you can see the calcium deposition. So in this dystrophic calcification in degenerated tissue, you can just quote examples of atheroma, dense old scars, stroma of tumors, then or goiter of the thyroid. All these places, all these sites shows dystrophic calcification. I hope you are clear. So we have covered dystrophic calcification definition, how you can see the metabolism is a very normal thing. Metabolism is a very normal process, but deposition of calcium is happening, right? Deposition of calcium is happening from the blood vessel to the dead tissue, right? Then again we have studied regarding the causes, the types, two types of the dystrophic calcification. It can occur in the dead tissue as well as in the degenerated tissue. So the dead tissue, two examples we are quoting is caseous necrosis. It will undergo calcification in TB. Then again in breast we have taken the example. In degenerated we are going to take the dense old scars, atheroma and all. So here comes a very beautiful part. We'll go to the pathogenesis. I told you in the beginning the etiology, the pathogenesis of two calcification. Which are the two calcification? Dystrophic and metastatic. Yeah, the both calcification, dystrophic and metastatic, the etiology and pathogenesis both are different, but the morphology is same almost. Okay, so we'll just go to the pathogenesis of dystrophic calcification. What happens mainly in dystrophic calcification, you know, right? What happens? What happens? So what happens? There is a deposition of calcium salts, right? What calcium salts? Crystalline calcium phosphate. How you are getting the crystalline calcium phosphate? See, phosphate ions is going to bind with the calcium. It will form the crystalline calcium phosphate. That is the deposition of the calcium salts. So how it is happening? Which process is happening? So there are two phases happening in the deposition of these calcium salts. So what are the two processes? Initiation and propagation. It's like a two process. Okay, the initiation, it is another name for initiation is a nucleation. It is a two-step process, and after that propagation will happen. There comes the deposition of crystalline calcium phosphate. So in the initiation, what happens in the initiation? Injury will be there, right? Injury has to happen. Why? Because it is happening in a dead tissue, right? So obviously necrosis will happen, means already dead tissue. So what happened? This dead tissue, suppose okay, we'll just see this. Okay, so if you want to see like the dead, already the tissue is dead, right? Yeah, the tissue here is dead. So the dead tissue, the membrane damage will be there, right? In the dead tissue the membrane damage will be there, and this damaged membrane, it will release the phospholipids. Why it is releasing phospholipids? Because membrane is made up of phospholipid, right? Membrane, the cell membrane, the membrane is made up of phospholipid. So this membrane will release phospholipids. Why it is releasing phospholipid? Because the tissue is already dead. Because of some injury or inflammation, the tissue is already dead. As you can see, I have written necrosis. Since the tissue is already dead, the tissue is having a membrane, right? The cell membrane. It is going to release phospholipids. Since after the release of phospholipids, what happens? soon one enzyme will come, which is the enzyme phosphatase. This phosphatase enzyme will come and convert this phospholipids into phosphate ions. Okay, once again I will just tell, there will be a death of tissue. Necrosis is going to happen in dystrophic calcification. It's like a step ahead of the necrosis. So if necrosis means obviously the cell is going to die. Cell is going to die means cell is going to burst out. That means the cell membrane, it is made up of phospholipids. So the cell is going to burst out means the cell membrane will release the phospholipids, because the cell membrane is made up of the biphospholipid layer. So once the phospholipids is released, one enzyme will come and change this phospholipids into phosphate ions. So after that, what happens, this calcium where you can see the calcium, the calcium, initially I will just see I have told this is a blood vessel. In dystrophic calcification, a normal calcium, right? So where is happening the dead tissue? Yeah, here the dead tissue, right? Once this conversion happens, this calcium phosphate, not calcium phosphate, the phosphate happens, right? The conversion of phospholipids to phosphate by which enzyme? Phosphatase. Once the phosphate is there, calcium have a tendency, calcium is like a very good buddy. Calcium is a good buddy to the phosphate. Calcium will soon go from this blood vessel and bind with this phosphate and forms a calcium phosphate. You can see here, you can see here, right? Calcium phosphate. What happens in the dystrophic calcification? Obviously the formation of calcium phosphate. How calcium phosphate is formed? From the phosphate ions. How we are getting phosphate ions? Because once the tissue is dead, then it is going to burst out. Once it is going to burst out, the cell membrane is made up of phospholipids. It is going to get converted to phosphate ions. How it is going to get converted to phosphate ions? Enzyme will come and convert. Which enzyme is coming? Phosphatase enzyme. So what did we are getting in the ending? Phosphate ions. And how are you getting the calcium? Calcium is there here, right? Because calcium have a severe attraction to the phosphate ions. Calcium will go and suddenly will bind with the phosphate. See, calcium will go and suddenly go and bind with the phosphate ions. And what forms? Calcium phosphate, isn't it? See, you can see the calcium phosphate. Then again, I told you, it is a combination of two processes. Initiation already happened, then propagation. Propagation means after this formation of calcium phosphate, more calcium phosphate will be formed, right? How more calcium phosphates will be formed? Obviously, more damage of tissue, more phosphate ions will be released. More phosphate ion released means more calcium will go from the blood to the binding with the phosphate. More calcium phosphate will be formed due to the initiation process. So after that, some structural changes will happen, and hence finally it will form into crystals, mineral crystals, calcium crystals, hydroxyapatite. You can see crystalline calcium phosphate. Crystalline calcium phosphate means the calcium phosphate has undergone the process propagation. So this is the pathway, the pathogenesis of dystrophic calcification. The thing you have to remember is why the calcium here, the calcium level is very normal, right? The metabolism is normal, the calcium level is normal. Then again, why calcification is happening? Why again, even the normal calcium level, though the calcium level is normal, then again why this calcification is happening, right? Why this calcification is happening? Because the tissue is going to produce some attracting factor. Which tissue? Dead tissue is going to produce some attracting factor. Which is the attracting factor here? Phosphate ions. How the tissue is producing that attracting factor, phosphate ions? Because the membrane will release phospholipids, and soon one enzyme will come. It will convert that phospholipids into phosphate ions. So hence this normal calcium, the level is normal, but this calcium will go and attract to the phosphate ions. So this is how, even though the metabolism is normal, but the calcification is happening. So there are the two processes, initiation and propagation. Propagation means nothing, just it's like a modification. It's like doing some modification after the initiation process. We are going to modify that calcium phosphate into crystals. Why? Because the product is crystalline, right? The crystalline calcium phosphate. So this is regarding the complete dystrophic calcification, and next we will study regarding the metastatic calcification. Okay, here comes we are going to learn regarding the metastatic calcification. So metastatic calcification is another second type of calcification. It is due to the abnormalities in the blood, right? Abnormalities in the blood, right? Before it was like the blood level, the blood serum, the calcium level in the blood serum was normal. So here the calcium level in the blood is not normal. So what is the abnormality here? It is a hypercalcemia, like there is an increased amount of calcium in our blood. So here we will just see the origin, where you can see the deposition of the calcium in the normal tissue. In the dystrophic, it was in the dead tissue. In the metastatic, you can see in a normal tissue. Then again comes the metabolism. In the dystrophic, it was like normal metabolism. There is no, it is a normal level of calcium level, no hypoglycemia, like no hypercalcemia, no hypercalcemia. So here in the metastatic, already, as we are already told, there is an abnormality in the blood. Which abnormality? There is a hypercalcemia. There is an increased calcium level in the blood. So here the normal metabolism will be there? No, obviously no. Because in the dystrophic calcification, the metabolism of calcium is normal. So the calcium level is normal. Here the calcium level is abnormal, like hypercalcemia. So obviously the metabolism is also abnormal. There is not normal calcium metabolism. Here the reversibility, yeah, we can reverse the process because it's not going to happen in a dead tissue, right? Here the deposition is going to happen in a normal tissue. So here we can just reverse the process. Like if we are correcting the metabolic disorder, we can reverse the process. And we'll just see the definition. The deposition occurring in the normal tissue whenever there is a hypercalcemia. The deposition means what? The deposition of the calcium salts. I have already written the deposition of calcium salts in a normal tissue due to the deranged calcium metabolism. In the bracket, you can just write down the hypercalcemia, like increased calcium. And again, we have to study how this increased calcium level is happening, right? There is an increased calcium. The hypercalcemia is happening in this calcification. It is either due to the excessive mobilization of calcium from the bones, like as you know, right, the bone, they have a lot of calcium. The bone is having a lot of calcium. Either the calcium will be coming from the bones, or the excessive absorption from the gut or from the intestine. We are getting a lot of calcium, we are absorbing a calcium. So these are the two factors you can just see for the hypercalcemia. So we'll just go to the causes. As I told you, the etiology and pathogenesis of both calcification is entirely different. Okay, so here you can just see there are four causes. There are four causes which leads to the hypercalcemia. Again, this hypercalcemia, it is going to lead to the causes is going to lead to the hypercalcemia, and hypercalcemia is going to lead to the metastatic calcification. Okay, then we'll just see what are the causes. What are the causes of what? Metastatic calcification? No. Before metastatic calcification, what has to happen? Hypercalcemia has to happen. We'll just see what are the causes for the hypercalcemia. Okay, so what are the causes for the hypercalcemia? Hypercalcemia means what? The calcium level will be more. So either due to the parathyroid hormone. So before that, I will just say which are the things that control the calcium level in our body. The controlling factor of calcium level in our body is, one is parathyroid hormone, PTH. Another name is PTH. One is parathyroid hormone, which actually controls the calcium in our body. And one more thing, the vitamin B. Vitamin D also helps in the absorption of more calcium from the food, from the gut, from the intestine. So these are the two factors. Sometimes neoplasm is also there, but mainly the two factors that controls the calcium level in our body is parathyroid hormone and vitamin D. So here you can just see all the causes I have listed out. Mainly due to the hyperparathyroidism. Hyperparathyroidism means more amount of parathyroid hormone. So I already told you parathyroid hormone controls the calcium level. So more amount of calcium will come. Bone resorption will come. Bone resorption means what? I told you bone have a lot of calcium. So what happens is calcium will mobilize from the bone to the blood. So eventually what happens, calcium level will be more. If calcium level more means hypercalcemia happens. Hypercalcemia happens means that calcium will go and deposit in the normal tissue. If it is going to deposit in the normal tissue, it is a metastatic calcification. So what are the reasons for the hyperparathyroidism? Like the more parathyroid hormone, it can be primary as well as secondary. The primary reason, it can be due to the tumor, the neoplasm, the cancer of the parathyroid, or the secondary is renal failure. Then again, you can see this increased calciumia, the increased calcium. I told you third factor, like neoplasm. In the neoplasm cases like myeloma, leukemia, all in cancer cases also you can see. Again, third factor I told you, the main factor I told you, the parathyroid hormone and vitamin D. Third factor, vitamin D. In these disorders like more vitamin D intoxication, on all these process, you can see a lot of calcium. So eventually it will lead to hypercalcemia. So these are the causes. What are the causes? Like mainly the parathyroid hormone you have to tell, and vitamin D you have to tell. Because of the excessive mobilization of calcium from the bones, that is, the process is called bone resorption. And another is excessive absorption of calcium from the gut. Who is helping for that absorption? Which the component is vitamin D. It helps in the more absorption of calcium. Then comes the simple patho. There is no like initiation, propagation. No, there is nothing like that. What happens here? The binding of inorganic phosphate and deranged metabolism means deranged calcium metabolism. As a result of deranged calcium metabolism, what happens? Increased calcium will be there. So the increased calcium, it will go and bind to the inorganic phosphate, and obviously it will result into the precipitation of calcium phosphate. Before that, I will just draw one diagram. Last time we have drawn, right? This is the what? This is a blood vessel, and here what is the calcium level will be more, right? Here it will be more. There it was normal, and here which is this tissue? This is a normal tissue. Okay, this is a normal tissue. There it was a dead tissue. Here what happens? This calcium will go and accumulate in the normal tissue. Okay, just for your understanding, here calcium level in the blood is a very abnormal. More calcium is there, so the calcium will go from this blood vessel to the deposition in the normal tissue. Okay, again in the dystrophic calcification, we have already told, since the calcium level is normal in the blood, but again why calcification is happening? Because the membrane, the damaged membrane is after bursting, the damaged membrane is producing some attracting factor like phosphate ions, right? Why? Because the calcium is a very good buddy. The calcium is always attracted to the phosphate, which is produced by that corresponding dead tissue. So here why calcium is again going and depositing in the normal tissue? What is the attracting factor here? What is the attracting factor here? Can you tell me? So what is the attracting factor here? Here the attracting factor, there it was attracting factor was the phosphate ions. Here the attracting factor here is, if any tissue which lose the acid, means obviously what happens? Alkaline medium, right? Alkaline environment will be there in the cytoplasm. So any tissue which has an alkaline pH, what happens? That is also attracting factor for the calcium. So this calcium will go and precipitate in that particular environment. So in the dystrophic calcification, the attracting factor for the calcium is phosphate ions. Here in the metastatic calcification, the attracting factor is alkaline environment. The calcium will go from the blood. Already there is a excess amount of calcium, and this calcium will go from the blood and it will go and accumulate in the normal tissue. Why? Because the attracting factor is an alkaline environment. It is an alkaline medium. Why? Because that pH, the pH, alkaline pH is very susceptible to the calcium precipitation. How do you get an alkaline pH? When any tissue, if they lose the acid, you get an alkaline pH. So that is a factor here. In the dystrophic, the attracting factor is phosphate. Here the attracting factor is alkaline environment, alkaline pH, because alkaline pH always favors calcium precipitation. Calcium precipitation. How the tissue is getting an alkaline environment? Any tissue, if they are losing acid, you get a alkaline environment. So this is regarding that metastatic calcification pathogenesis. Very simple, and the sites of it we just see in a very brief manner. The tissues with the alkaline pH, I already told you, the tissues with the alkaline pH, it will precipitate the calcium in the alveolar walls of lungs, in the basement membrane and tubular lamina of kidneys, the interstitial gastric mucosa region of stomach, Then again in the parietal cells, you can just see the parietal cells and all. The in the stomach it has parietal cells, right? The parietal cells, if they are losing HCl, the hydrochloric acid, again the cytoplasm will be having a alkaline medium, so obviously calcium precipitation will come. Again another sites are like cornea, conjunctiva, blood vessels. These all, if they're getting the alkaline pH, obviously calcification will happen. So here I have written already the tissues who are losing acid, alkaline pH will be more. So since the calcium is insoluble in alkaline environment, calcium will deposit. So the process I have explained in the downside. So last thing, we'll just go to the morphology. I told you the pathology and pathogenesis of both calcification, dystrophic and metastatic is different, but the morphology is almost same. You can see the gross appearance, you can see a chalky white appearance. Chalky white appearance you can see the chalky white appearance here. Yeah, the chalky white appearance you can just see. Why? Because that calcium deposition, okay. And the feeling, the texture will be like sand, stony coarse feeling, the sand texture. Then microscopically you can see, this is a microscopic view. If you are seeing the microscopic view, you can see there is a lamellated configuration called samoma bodies. You can see the sorry, you can see the samoma body. See, these are all are like calcium deposition, okay. This is like calcium deposition in layers. So this is the morphology of calcification: chalky white appearance, stone coarse feeling, texture, samoma bodies. These are very important, okay. And we have concluded the causes, etiology, the pathogenesis. One thing you just have to remember, it's that thing, dystrophic calcification means, main thing, you can't reverse the process and it will be in dead tissue, DD. Why? The calcium is again depositing, though the metabolism is normal, there are attracting factor, phosphate ions is getting created by the dead tissue. Then in metastatic calcification, what is the attracting factor here? Since which is the factor? Alkaline environment. Any tissue which lose the acid, it will create an alkaline pH which favors the calcium precipitation. These are the sites. And morphology: chalky white, the stony texture feeling, and the microscopic you can see the samoma bodies, okay. If you have any queries, you can just ask in the comment section. Thank you for listening.